Hi there, thank you once again for joining me on the program, Your Doctor and COVID. I'm your host, Dr. Mahendra Carpen. I'm the head of Medical Services and Cardiology at the Georgetown Public Hospital Corporation. If you have any questions or comments regarding the COVID-19 pandemic, please feel free to send us a WhatsApp to 620-6275 or send an email to docandcovid@gmail.com. We're fortunate to have a long continuing conversation with Dr. Tracy Bovell, emergency medicine specialist attached to the Georgetown Public Hospital Corporation and also the key and lead physician at the Lillian-Dahl Ocean View COVID facility. Welcome again, Dr. Bovell, to our conversations around the COVID-19 pandemic and your area of expertise.
Thank you very much, Dr. Carpen.
So what is it that you really enjoy about COVID-19 practice?
I think everything.
Yeah?
I think everything in that I enjoy the simple fact that we started off not knowing anything about this illness and we are able to make such a significant difference. I enjoy the fact that I can actually make a significant contribution to my country and to ensure that our patients, even though we are a third world country, we're doing good.
I think we're doing good. We're doing good. When we do,
so for we are doing good.
When we do the comparison to other countries that are not considered third world, I mean, we're not too shabby.
Right, exactly. And when we look at the medications that we're using,
we're
using first world. We're using first world medications. So I like that. That's what I really enjoy about the job.
Yeah. So our outcomes, our results in this pandemic is, thanks to persons like yourself, dedicated, committed, experienced, and willing to learn, willing to change, willing to adapt. And it bodes well for the future of this country if we can keep you here.
This is my home.
So you've been at the Lillian-Dahl Ocean View facility now since we started taking patients there on a more regular basis. What has your experience been like over there?
So it's been a different one. It's been new. It has had some challenges, but it has actually shown us the possibilities of this facility. It has actually been able to allow us to better cater to a larger population of patients and have a step-down unit for patients that is not only on the transition unit.
Right.
So we have a bigger facility. Now, please note it's not the entire facility we have been able to use so far.
Right.
But the spaces that we have been able to use has actually given us more space to function and to better cater to our patients. We used to have specialties visiting the ICU and the different units. We still have those persons visiting the Ocean View facility. So all the services that used to be offered at Georgetown Public Hospital for the COVID-19 patients, the majority of it is at Ocean View facility now. We do not have the operating theater operational as yet, and we do not have as yet. Please note, as yet, as yet.
But it's coming.
But it's coming. It's definitely coming. We have not actually moved over the maternal patients as yet, but that is definitely happening pretty soon, so that we can have at least all of the inpatients stay at the Ocean View facility for now.
Good. And in terms of staffing, on average, how many doctors, how many nurses do you have up there?
So for staffing wise, we have about 4 to 6 nurses and we have 25 doctors. And the number increases on a daily basis. So what
kind of shift system do they operate, doctors and nurses?
So initially the nurses used to work 8 hours. The ICU nurses used to work 6 hours. And the physicians have always worked 12 hours, and now we have actually moved forward to being able to work 12-hour shifts. In that way, you can, one, decrease the amount of staff that you need, and two, you can increase the amount of rest time that people get, as in they're off duty. Because you not only want to look after your patients and their safety and their mental health, but you also want to cater to the mental health of your staff and your colleagues. You want to ensure that they are okay and they get time to recuperate, and they get also time to spend with their loved ones and their family members.
Right.
So with the 12-hour system, they're able to get, I guess, the best of both worlds.
Right.
You get to work your duty, you get to help persons, you get to help to save lives, but you also still have some kind of quality of life where you can spend time with your mother, your father, your husband, your wife, your children. You can still get to go to the market and buy your stuff and still work COVID.
I know in some countries where they have a lot more resources, they would have asked healthcare workers to, for example, leave their homes and be put up in a hotel or, you know, a living facility 2 weeks at a time, so that they could just go to hospital and that facility and away from their families. What are your views like for an arrangement like that in Guyana?
So, interesting thing is that we offer that possibility early up. And when we weren't aware of what this illness is going to bring, everybody was willing to say, no, I prefer to stay away from my family. But now that you know how to protect yourself and you know what to do, what to wear, how to go about your job, people have realized that, hey, you do not need to stay away from your family completely. What you need to do is ensure that you're wearing your protective equipment and the entire time, protecting yourself, protecting your colleagues, protecting your patients, and by extension, and please note, it's only by extension, you do that and you protect your family.
Right. You do the simple things, you do it correctly, and you do it all the time.
Every single time, and you don't miss a time.
What systems do we have, or how are maternity and pediatric patients dealt with at the Ocean View facility?
So they have different rooms, and we cater to persons according to what they present with. So you have the transition area, which is for your suspected patients, and you have your COVID-19 positive stable area. You also have your transition ICU, which is for your suspected patients, and you also have your ICU, which are for your ICU patients that are COVID-19 positive. So they have areas that are allocated to different persons within these areas. However, depending on the amount of persons you would cater to in that room, you would put those amount of persons in that room. If you do not have a maternal case, you would not keep that room empty. Right? So you keep that flow always. So there is space, there is a capacity to cater for those persons. And we've had multiple children go there. And we've also had multiple maternal mothers go to the facility and be treated as well. So we have a midwife on duty. We have physicians, and we also have this specialty actually visiting every day, reviewing their patients, checking on their patients. Labs, we take off all of our blood tests. We send off all of our blood tests on a daily basis. And if there's an emergency and it has actually passed the daily basis time, it still goes down. And we get our labs turned over pretty quickly.
So is the lab service actually at Liliendale, or do you have to send it to Georgetown Hospital?
It actually isn't. It's a 10-minute trip.
To Georgetown Hospital?
It's a 10-minute trip to Georgetown Public Hospital. And we have been getting our lab results in a timely manner. We've gotten, and that's why it's so good to be part of an awesome team like the one that we have at Georgetown Hospital. Because you have people coming out, you need blood. Somebody's blood count is very low. You need blood. It's 1 o'clock in the morning. No, it doesn't matter that it's 1 o'clock in the morning. You need the blood.
And you need it now.
You need it now. They will come and they will fix it. Everybody is willing to come out and make that difference and make that step, that extra step that really makes a difference.
Yeah.
And that's the level of cooperation that you see with us dealing with COVID-19 patients.
Well, those are the kind of sentiments that give me hope and optimism for the future of healthcare in this country. What kind of expansion plans do you envision for the Ocean View facility?
So definitely we are planning to, as I said, we are planning to open the maternal wing. We are going to be having dialysis. We're planning to eventually have dialysis in that facility. Definitely we're going to have our operating theater. But the thing about it as well is that we want it to be a facility eventually that is going to stand on its own.
Okay.
In that your patient no longer has to go to another facility and then be transferred. They can come directly with the complaint,
Right.
and they'll be able to be triaged, seen, stabilized, and then admitted. But that is all dependent on the triage area being fully set up and your transition area being fully set up for your observation patients. We have the pharmacy operational now there, right there at Lilindale. Yes.
Okay, so they dispense medications to patients.
Yes, we do.
Excellent.
But we don't need to, those are patients that are in the hospital, within the hospital facility already, the inpatient admitted patients. So it's just a matter of filling the treatment sheet.
Right. So you're also on the Emergency Operational Center, right? And now those, that body tend to also know what's going on nationally, what's going on in the country. Where do you see our needs as a country exist for during this COVID-19 pandemic? What do you think our greatest needs and challenges are for Guyana?
So I'm not really part of the HUC anymore.
Okay.
I guess because of the other responsibilities that's happening, we have another representative on that committee. But our needs, I'm actually looking to see what this vaccine has to bring.
Right.
I'm looking forward to see what this vaccine has to bring, because we have hopes that the vaccine will be able to curb COVID-19 completely. Like really and truly just get rid of it.
Make it into like another flu.
Exactly. Get rid of it, or make it so insignificant that you're not having these amount of persons that are dying, or these amount of persons that are getting so critically ill.
Right.
So
now, speaking of the critically ill, have you noticed any trends in those who are admitted in critically ill state? Is there anything common, anything
Yes.
noticeable among that group?
those are normally the persons that are either very old. They are the persons that are having they have comorbidities. And comorbidities just basically mean, now I know I don't have to explain that to you,
Yeah, but for
Dr.
our
Carpen,
viewers
but
and
for the
audience.
viewers, comorbidities would be like your other illnesses, things like HIV, things like tuberculosis, things like sickle cell anemia, things like diabetes, hypertension, asthma, all of those things that have already put your immune system at risk. And so you're already fighting one illness, and now you have another illness that is fighting you.
Right.
And so you find those are the persons that are already coming in. Oh, kidney injuries, those persons with kidney failure.
Right.
You're finding those persons that are coming in are the ones that are coming in critically ill and not doing so well.
Yeah.
So that's why we have always said, stay at home. If you're not feeling well, stay at home, call into the hotline, or if you feel that you're not unwell, you need to come to the hospital, either call 912, or you can go to your nearest health center and check with your physician, check with your nurse. Hey, this is Guyana. Everybody knows somebody.
Everybody knows somebody.
So you can always call a nurse or a doctor and say, hey, this is what's going on with me.
Right.
You do not need to necessarily pop up at the hospital, because why we've been asking persons to not necessarily come at the hospital initially was because of the same bunch of people that I mentioned just now. Now, those are the critically ill, and so you have your mild form of COVID-19, and you expose this person who has end-stage renal disease, and that same what was a mild form to you is now a severely ill form for this patient, and they can die from it. And so that's why we say it's not just enough for you to say, Granny, Mommy, you stay at home and I'll go out. When you go out, you need to protect yourself because
Right.
you're still going home back to Granny and Mommy. So it's some persons have always had the question, but they don't go out. How could this happen? But if everyone else is going out and they're
Right,
not
and they
being,
come back home.
exactly, and they're
they'll
coming
bring it
home and you're sharing the space.
Yeah.
So all of those things you need to be careful with.
Well, thank you very much, Dr. Bovell. It's been a pleasure speaking with you today. We have certainly learned a lot, and we again thank you for the service that you're providing to this great nation of Guyana. And thank you once again for watching, for listening, and for joining us on the program, Your Doctor in COVID. And I hope that you would have learned something and you would have understood a little bit more about the COVID-19 pandemic. Remember, if you have any questions or comments, please feel free to send us a WhatsApp message to 620-6275 or send an email to docandcovid@gmail.com. Thank you and enjoy the rest of the day or the evening.